Okay, so now we are going to talk a little bit about enamel hypocalcification and Turner's hypercalcification. So the name is enamel hypoplasia and Turner hypoplasia. So what is the epidemiology of enamel hypoplasia and Turner hypoplasia? Basically, it is the incomplete formation of organic enamel matrix. So it has to do with missing enamel. So basically, we have what is called Turner's tooth. And Turner's tooth is due to the local infection or trauma of the tooth. And this trauma is of the primary tooth, and this is periapical. So I have an arrow here pointing toward the tooth that is affected. It is the systemic infection causing enamel hypoplasia. Hypo meaning less, plasia meaning the development of cells. This is seen in diseases such as measles and chickenpox. Measles and chickenpox are related, which we will talk about in another video. Scarlet fever, which has to do with the bacterial illness from strep throat, and other infections from the first 2 years of life can cause what is known as enamel hypoplasia and Turner hypoplasia. So here we can see another thing called syphilic hypoplasia, as well as congenital, it's known as congenital syphilis. It causes enamel hypoplasia. So we have what's called Hutchinson's incisors and mulberry molars. So it's important to know that they are associated with those. It is also associated with anti-neoplastic therapy, which is radiation therapy, and childhood caries requiring radiation and chemotherapy. The ingestion of chemicals such as fluoride can cause enamel hypoplasia, and this is seen in what is known as dental fluorosis. Nutritional deficiencies can lead to dental fluorosis. Let's talk about the fluoride level. And basically, too much fluoride can be bad for you. So, about 0.6 to about 1 parts per million is the ideal level of fluoride. Once you get to about 1.0 to 1.8 parts per million, you start to see chalky white mottling and hypocalcified enamel. Greater than 1.8, you start to see more chalkiness and more hypocalcification. And when you're greater than 5 parts per million, you start to see more of a brown pigmentation, white mottling, and these are more severe cases and affecting a larger amount of the teeth. And you also see what is enamel fracture due to the weak enamel. So any amount of fluoride that is greater than 6 parts per million affects 90% of the dentition.